The Enhanced Lipid Reporting screening tool is a way to standardize doing cardiovascular risk assessments for patients in Alberta. I think it's very exciting. By choosing to use this tool, we're able to participate in sharing the care with our patients with others. It's captured not only in the lab report that I get, but it's also on Netcare and on other platforms, so that it isn't tied only to one provider or to one EMR, to one clinic, but this is a way for other providers in a clinic setting, an emerge setting, hospital setting, that we can have similar types of conversation to be like, oh, this is where your cardiovascular risk assessment is, based on these sort of factors that we're taking into account. My encouragement to any of my colleagues really is, of course, we can do it in our proprietary little bit in a chart note somewhere that was documented somehow that might be searchable if we had some sort of system involved. But really, I don't think that it actually creates more work for me. And in fact, it becomes part of my workflow to say, hey, these are the questions they need to know if I'm going to have this type of discussion with the patients. In order to get a complete report back, all of the risk factors must be put in properly. So it asks specifically for the systolic blood pressure, not the diastolic, just the systolic pressure. And it has to have an answer for all of the risk factors. So what is their smoking status? Are they being treated for blood pressure? Do they have diabetes? Do they have chronic kidney disease? What's their cardiovascular history? And then what we receive back is actually not only a report that captures the risk factors that we've submitted, but as well as their lipid profile. And then it will actually give us the score that they would have gotten on a Framingham risk assessment. And there's actually a little snippet of recommendations based out of the 2021 Canadian Cardiovascular Society guidelines. So my experience with using this tool has been really encouraging. I think my patients have appreciated that I have taken the time to talk to them about these risk factors, that we have a more holistic look, that we're talking about risk assessment and non-modifiable risk factors, their gender, their age, their family history, and then also about their modifiable risk factors. Do they have diabetes? What's their blood pressure at? Or what's their smoking status? And so really to say, hey, while we're here in primary care, what can we do to prevent future events from happening? Starting a medication or focusing on how they want to eat or what their exercise regimen is going to be. Those are all things that help reduce their overall risk. It's not to say if you have this number, then you have to start this medication, but it begins a conversation about what their values are. What do they want in their health? What's important to them? One of the reasons why I'm excited about this project is that it's not only for the physicians, but there's also a patient side to this. That once they receive their results, and it actually goes into my health records so they can access this result, but not only that, there's supplementary patient education tools that they can really dig in and try to understand. I think my patients have enjoyed having another piece of information that goes beyond just chasing a certain number on the lipid profile. If they have questions, then they can come back. And really, that's what I love, that this becomes a way of involving patients into their decision making, that they can take ownership about their health, and that's where I like to come alongside with my patients.